It's nice to meet everybody, and hopefully you've got a warmer day than we have here in the middle of winter in New Zealand. But anyway, I'll get on with this talk, and we're going to talk about ME/CFS, and obviously that nowadays tends to also include long COVID, because as you'll see as we go on, there's no doubt that that is the same sort of thing, really. So we have an illness that's usually triggered by a viral infection. There is a tendency to what we call a genetic vulnerability, which means that you can inherit the tendency, though not absolutely necessarily, but there are many, many family clusters around. And the whole condition is due to persistent overactivity of the immune system, whereby you get an infection and the immune system becomes very active, and the brain can become quite inflamed as well. And the whole underlying chemistry of your system becomes upset. We'll talk a little bit about the microbiome in a minute, but all this leads to a variety of symptoms. Probably many of you here have got very different symptoms to each other, but often the symptoms are very much mimicking the original illness. So if your illness started, let's say, with flu, you have flu-like symptoms quite prominently. Epidemiology means, how and when does it and where does it occur? And here in New Zealand, we have a population of about 5 million. And I think, if I'm right, that your population is similar. And so consequently, you have somewhere between 20 and 40,000 cases in the society that you live in. However, that hasn't really been fully established since the onset of COVID, so we can probably at least double that now. The initial illness may be quite mild, so people just carry on. On the other hand, it can be very severe, and you can be bedridden and very sick, and this may well hang on. All age groups. I've seen children as young as 4. Very difficult to diagnose in very young people and the elderly particularly because they do have many other health conditions. So you often have a long process trying to sort it out. It tends to be more common in females. And we think there are definitely some hormonal links there. Various things lead into it apart from just infection. There is the tendency for some family predisposition, and the patients often have had mental or physical distress in the lead up. And so, for example, an athlete who's training really, really hard perhaps doesn't give in to the initial illness, or even hasn't realized they've got it when they're training and pushing the body hard. Certainly some toxins, and that might be not exactly poisoning, but something you've been exposed to that hasn't agreed with you. And often there is some sort of infection or stress going on in the body otherwise. Things like surgery, immunizations have been questioned as to a possible trigger, though not necessarily proven. And certainly if people are not suffering from good sleep patterns, that can be a aggravating factor. So young mums with new babies are very vulnerable, and certainly viral illnesses are the most likely trigger. And which one? Well, commonly over the years when we've described this illness, the one that often leads the way would be what we call glandular fever or infectious mono, its proper name. And that particularly in young people who are possibly pushing themselves very hard with sport or school. And it's not much the pushing that causes the illness, but it aggravates and they don't give in as perhaps they should. And some of the herpes infections, and when we talk herpes, we don't just mean the sexually transmitted herpes, but many of the everyday infections we get are caused by one of the many viruses of the herpes family. And of course, long COVID is the one that we've all been very much aware of in the last 2 or 3 years, really, or more now. This is typically what may happen. I won't leave this on for very long, but just to show you, you get an infection, the immune system fires up, and so you get this firing up. And in about 90% of people with any infection, it will be gone in a month, all the effects from it. But in people who linger on, we have another probably 9% or so who over the next 6 months are recovering very slowly. And if they're lucky and they're looking after themselves, they will fall into that bracket. So at 6 months, 99% of people from, let's say, glandular fever will have improved to the point where they're feeling pretty normal. But there will be that 1% who linger on and on and on in a bit of a wave-like pattern. And they're the ones that we will label as suffering from CFSME. And stress aggravates. So you might be kind of coming right, and then some major stress. And that stress doesn't mean mental stress necessarily, stress that you put on your body, maybe not meaning to, but lack of sleep or hard at work or exams coming up. Those sort of stresses just give a little blip and prolong the recovery. And of course, that's the sort of person that can get ME, but not necessarily. So, very, very fit people are just as prone to the less fit to go down with this, and they're often pushing themselves very hard. A lot of symptoms, and that's just the beginning of the list of the many symptoms that occur. And I am not going to go through them all in detail because we'd be here all night, but many, many symptoms can flare during the course of the illness. They might come and go, and they might become aggravating factors too. A lot of research has gone on. And again, we haven't time to do all this today. In fact, any one of those studies probably could take the whole session up. But much research has been going on over at least 72, probably 75 years now. And they're learning a lot about it, although some of you may feel nobody seems to know anything about it. But in fact, the scientists are well into uncovering what is actually going on in this illness. It's just a matter of research is A, very expensive, and B, also most complicated. So often there will be just one small area of research that one particular group is researching. Probably no one can research the whole lot. These are some of the things in more simple terms that are being researched, and I think some of them will turn out to be more important than others. And certainly, I would put a big line under immunology. That is the study of your immune system. And we'd like to be able to say, yes, there's a huge amount going into treatment, and there is a huge amount going into treatment, but not a lot has been uncovered yet in the way of, for example, drug treatment. Metabolomics you may never have heard of, and I hadn't till quite recent years. But there's a man called Navio who has done a lot of research, an American, and again, I won't go into this, but he has found that people with chronic fatigue syndrome have a state in their system which is very like the hibernation that we see in animals that get, bears that dig underground for the winter. Often people have said to me, oh, I'd like to be able to go to sleep for 6 months. And, the actual what is going on in the system has been shown to be very similar to the hibernation state. And it's thought that the vitamin B12 that some people do get benefit from may be helping to protect the damage that this can actually cause. Um, Biomarkers are blood tests or brain tests, other tests, many, many tests that are being done to try and uncover the cause of the illness, but also give us what we call a biomarker, which is a blood test or skin test, some sort of test, brain test that you could have done that would actually mark you down as having that condition, a very definite yes, no answer. So all these researches are going on and they haven't as yet really found the true biomarker that you could have a blood test or a brain test or something that would just say yes, no. We haven't got that far yet. Except this man, Don Staines, and his team, Sonia Marshall-Grodiznik is the main leader now of the team. They have uncovered a particular mechanism which does seem to be highly likely as the main thing that might be going wrong. So again, I won't ask you to begin to interpret this because you have to be a fairly high-powered scientist to really understand what's going on. But what is happening is the way that calcium moves in and out of the cells is affected by this thing they call the TRPM3 receptor. And so calcium doesn't move in and out of the cells as efficiently as it ought to. And we all need that to be happening all the time. And this may well lead to many of the symptoms and may be one of the key abnormalities that's happening in this illness. Warren Tate is a professor of biochemistry here in New Zealand, and he has also found some very significant serious abnormalities in the body. And we know that our systems are all controlled by chemistry, and he's found some particular abnormalities that seem to link and impact on each other. And again, I'm only telling you these things not because I understand them probably any more than you do, but because they are considered very, very important researches. And there's also some excellent research now coming out of Oxford University. Warren Tate describes it as a big jigsaw, a molecular jigsaw, and there's some pieces still missing. We understand quite a lot, but we've still got a few bits to fill in. So how do we make a diagnosis? Well, that's initially a matter of going through the usual process that you go through when you're trying to make a diagnosis for any illness, really. And I must say that it's in many ways with this a process of elimination. And you need to do quite a lot of routine blood tests and things like that. This is why when you go to the doctor, it's often very difficult to make a diagnosis because all this lot takes a long time. It's not something the doctor can just achieve in 10 minutes. And so consequently, the patient may well have to have a long consultation follow-up to discuss all this further, or may well need lots and lots of investigations before you can even begin to get there, really. So that's very frustrating for both the doctor and the patient. But at the end of the day, unless you go through it properly, you can't hope to make a clear and easy diagnosis. Other things overlap. Or may be the cause of the symptoms, because a lot of these symptoms could be of psychological illness. They could be a neurological illness, all these other things here, because fatigue is probably one of the main symptoms of many, many diseases. So because a person's fatigued doesn't mean to say they suffer from chronic fatigue syndrome. They may well suffer from all manner of things. So that's why you have to be very, very careful and very thorough when you're trying to make a diagnosis. This list, and I notice there are one or two questions about some of these things, but these are things that are very similar or overlap. So you may have chronic fatigue syndrome, but you may also, as part of the CFS, have a sleep disorder or an autoimmune condition, any one of these things which are similar. Sometimes they occur as well together because it is absolutely possible, unfortunately, to have more than one thing wrong with you. So the doctor may well tell you you've got fibromyalgia, but that may just be part of the whole CFS scenario. I'm just going to shift off all that a little bit and talk a little bit about sleep because sleep is one of the main aggravating factors or symptoms of this illness. And this is just to show you a normal sleep cycle. And you have a phase where you're awake when you first tuck down in bed, and then you go down through these various stages of sleep into sleep level 4, which is the very deep, deep sleep where your body tends to heal itself if you've got an illness. And then you come up and you go down and you go up and down. And gradually, as the night wears on, you drift out of sleep and you become awake. Now, if you get a nice normal sleep cycle like that, healing from any illness or fatigue from any condition is going to be enhanced and improved. And so that's what we aim for is a nice regular sleep pattern. And unfortunately, people with CFS sometimes don't go below there. It's a very aggravating problem with the sleep. And so you may well be seemingly asleep for 7 or 8 hours, but you wake up in the morning feeling that you haven't really slept much at all. And during those low levels of sleep, you release all the hormones and the chemicals that help your body recover and heal. And so a good sleep routine is really important. And this man, Markku Partanen, is a Finnish sleep researcher, very well-known man in Europe. And he has talked about the orexin system, which is the system that regulates your body clock, and it's just not working properly in this illness. If the orexin levels are low, it triggers sleep. You drift into sleep, you get restoration and improvement, and when it's low, you tend to feel sleepy. When the orexin is high, you're ready to wake up in the morning. But a higher exit makes you feel very sleepy. So the aim should be not to have higher orexin levels, but lower orexin levels so that you tend to go to sleep and sleep better. And a snack at bedtime seems to improve this tendency. So we recommend a possibly carbohydrate snack at bedtime, drink with some sweetness in it, something like that. And that can help improve your sleep. It doesn't, not like a sleeping pill, but it just gives you a better quality. I drift straight off sleep into other things because people obviously do like to find out about what may help them and how we can manage the illness. So we have to say, first and foremost, with any illness, there's got to be a correct diagnosis, and that can be a very long-winded problem. Stress management important because stress, although not necessarily the cause of an illness, aggravates, and that could be mental stress or the physical stress of over exercise, things like that. Time outside. When you go outside, you release melatonin, which helps you with sleep, and you enhance your vitamin D levels. And vitamin D levels have often been shown to be low in this illness, and that can lead to fatigue. So these are all very simple non-drug type approaches, really. Exercise people often think, oh, if I get my exercise up, I'll surely get better. But in fact, we know for sure this is one illness that exercise really aggravates if it's pushed beyond the comfort zone. And the comfort zone may be nothing much more than walking from the bedroom to the lounge. People with this illness can really almost fall over with fatigue if they push themselves beyond the absolute basic requirement of daily living. Good diet can't ever go harm, and balanced nutrition really important. And again, if you're sick, you tend not to eat and can't go shopping, may not eat properly. And it's been found in this illness that extra salt can make a really big difference to improving the energy. It needs to be carefully monitored so your blood pressure doesn't go up too high or anything like that. But we can actually also give a drug called fludrocortisone, which helps to keep the salt levels established. Some supplements are helpful, but again, not in a curative way. These things I'm mentioning here are just mentioned because they can improve some of the symptoms, but I think none of them are sudden magical cures. They can just lift the energy a little bit. And hormonal management really important for women. You find more women than men tend to have the illness. So estrogen can be helpful in women with this illness as long as it's considered safe for that particular woman to take the estrogen, but it has been shown to be helpful. POTS is the tendency to feel faint if you're standing for any length of time or tip over even, and that can be treated with medication and extra salt. Sleep we've already mentioned, and these medications I've just listed there are very much traditional medications for sleep, but ones that are considered safe and generally quite suitable in this illness without being habit forming. Um, Pain control, well, there's an endless list of painkillers, of course, and those ones I've mentioned there have just been shown to be useful in this illness, perhaps more so than some of the more traditional sleep pills. And of course, there are many drugs under use in sort of trial basis, not necessarily going to cure the condition, but certainly helping with some of the symptoms. A lot of drug trials going on, and again, no time to go through all that lot today, but two that stand out have been shown to be useful up and coming drug trials, really, because none of these are completed drug trials, they're just in the pipeline. Pyridostigmine is used for a neurological disease called myasthenia, and it can be useful at relieving the symptoms in a percentage of patients. And then low dose naltrexone, which you may or may not have heard of, but that does help if your brain can go back a few slides to the work that's being done in Australia by quite a leading team now, and they are using this low-dose naltrexone, which helps the way that the calcium moves in and out of every cell of your body. And this may well be an important key to the understanding of the illness, apart from being a potential well worth trying treatment. Difficult to get in some places, in that it's not available in every country, but it's not difficult to get, and a very small, tiny wee dose, 1 milligram of a drug that can go up very high. 1 milligram can help a lot with some of the symptoms. It takes a little while to work. It's not hugely expensive like some of the drug stuff that you hear of out there, but it still costs money. We're talking here in New Zealand probably about $60 a month, which is about 60 euros, I think, not far off the same sort of rate anyway. Um, Not everyone responds. In fact, some people will say, "Well, I took it for 6 months, it did nothing." But however, some people do feel quite a bit better on it. And it works by controlling the way the calcium moves in and out of the cells, and the low dose naltrexone can lead to not necessarily any cure, but certainly some improvement in your symptoms. So what other ongoing issues are there? Well, pregnancy is often something that women with chronic fatigue syndrome will fear because they feel that they're already feeling tired, and pregnancy and a new baby can make you feel even more tired. However, the hormones that you produce in pregnancy and breastfeeding can be quite help in improving the condition. So many women do take some form of estrogen with this illness to improve some of their symptoms. A lot of talk, of course, of immunizations these days because of the issues surrounding, in some countries, compulsory immunization for COVID. So there will always be some people who respond badly to immunizations of any sort, and that's due to the way their system is built, perhaps, an increased tendency, excuse me, to that sort of thing. So we have to say not everyone is going to feel okay after, for example, a COVID injection, but then you have to weigh up it against the risk of not being immunized and the risk of getting the illness, be it COVID or flu or anything else, which may in itself lead to chronic fatigue syndrome or a worsening of the illness if you've already got it. So you have to weigh up the pros and cons, discuss it with your GP, read up as much as you can, and perhaps make a very informed decision. And if you have got this illness and you have to have an immunization, make sure you take some time out from work or rest period so that you give yourself the best possible chance of getting over the the immunization that you might have felt you had to have or you've been recommended for you to have. But then there's, of course, the issue with the illness of regular maintenance. Not just things like the illness itself that needs to be watched for, but making sure that you don't miss other things. I mean, for a start, you might not have the right diagnosis. As doctors, we're not foolproof, and we aim not to make mistakes, and we very rarely make serious mistakes, but there's always the chance that your illness might have been diagnosed as chronic fatigue syndrome or not diagnosed as that when it might have been. So watch for new symptoms and also be on the lookout for new treatments because with every illness, there is all the time research going on, and this one's being no exception. And so there may well be treatments out there that could benefit you or be worth a try, but don't go mad. Some people spend a lot of money on things that have been a real have, someone trying to make money out of vulnerable people. So you do have to be very, very careful. And although you're not a research scientist any more than I am, you need to look into things carefully before you spend your money or get drawn into some sort of scam situation of buying pills on the internet, that sort of thing. They may be absolute rubbish or they may never arrive. So just be very watchful. About a third of the patients I've seen over the years, and I am talking probably about, now I looked at it not so very long ago, about 9,000 patients. Um, there will be about a third of the people that we end up when we think we have chronic fatigue syndrome as a diagnosis, but it may not be right. So the diagnosis can often be something else lurking in the background, or you may have more than one thing wrong with you. That's a bit of a gloomy thought, but on the other hand, it's the reality of medicine. So, you kind of need to keep seeing your doctor if I don't know what your cost is in Ireland, but here it's very hard going. We have to pay for medical treatment, or patients do, and many can't afford it. It's not like in America, huge, huge sums, but it's still quite a struggle for many people. And so to have to keep going to the doctor for surveillance or different diagnosis possibilities is quite hard. There's a tendency to, and rather a gloomy thought, for some people with this illness to have signs of aging sooner. I mean, that may be partly the worry, but on your chromosomes, you have little things called telomeres, which get shorter and shorter as you get older. And the telomere aging has been shown to be a little bit more rapid in people with chronic fatigue syndrome. So it's a sign that you really do need to look after yourself properly. And there's also, of course, I'm not saying there's an increased cancer risk, but because so many symptoms of cancer can be very similar to the symptoms that some people get in chronic fatigue syndrome, you need to be having your regular cancer testing, things like prostate and breast and what have you. Other things that we need to be very aware of, that symptoms are always aggravated by stress, pushing yourself hard, overactivity. So you want to pace yourself carefully, get out in the daylight, sunshine as much as you can, because that can help for sure. You release more melatonin, you deal with your vitamin D better, and these are two things that have been shown to be abnormalities in this illness. And then practicing regular relaxation, that's really, really important, because it doesn't matter what's wrong with you. We're not saying with this illness it's all in the mind, but we are saying that mind improving techniques can make a really big difference to the way your body handles the illness. So it's certainly really important to be aware of that and take on board one of these sort of techniques, maybe to getting some counseling help that can be really helpful. Um, this is actually just an example. In New Zealand, we have the ANSMES Association, which is probably very similar to your association in Ireland. And these people are there to help. They're often people who have suffered the illness themselves. But with any illness, there's nothing like getting together with other people who've had an illness. I mean, you don't want to sit there and all be gloom and doom, but at least understanding that you're not on your own. Because one of the hardest things with this illness is having to cope alone and having to convince even your close family that there really is something seriously wrong with you that needs some sort of help and assistance. And so I think joining a support group, which probably most of you here today have, is a really important part of the whole management of the illness. So I think, don't hesitate to do it. Some people are very shy about this kind of thing, or your doctor may not even know about it. So you may have to explore yourself to find the right sort of support for you. There are, here in New Zealand also, and again, I imagine in most countries of the world, support groups for specific types of people of ME. Some of the people may be mums, pregnant mums, or mothers of children who've got the illness. So finding out what's available in your particular locality is a really, really useful thing to do, really. I think I always say that most or all ME patients can certainly experience a better quality of life with compassionate care and a multidisciplinary approach. And by that we mean not just the doctors, but the family members, someone being understanding and being able to guide you in the right direction. That sort of thing is really, really important. And you need to feel in control of your health rather than being controlled by the disease itself. A lot of people have sort of either labeled themselves or been labeled as a sufferer of a particular disease. And that's all very well, but it can be quite a negative approach, really. And it's better to be thinking, well, maybe I've got chronic fatigue syndrome. Let's keep on looking and making sure I've got that right, or my doctor has got it right. And what can I do to help myself? What is out there to help me? And how can I best get by daily life? I may have to change my job. I may have to stay off school. There's all sorts of part of the management approaches which are in some ways often considered rather negative and difficult, but on the other hand, really important at helping you feel in control rather than being totally controlled by the disease itself. There are quite a lot of resources out there, and again, I'm sure that this can be printed out for those of you that want it. There's certainly a huge range of stuff out there, really, online now. I think when I think back, 20, 30 years ago when I was working in this illness, we didn't have anything online at all. It didn't exist, probably, only just beginning to exist. But at least now, you can go through and scrolling around, find out what's out there, and the lists become never ending. And I think it's important, however, not to become totally obsessed with reading your phone all the time, that kind of thing. It's much better to get out and sit in the sunshine or have a little wander around your garden and smell the flowers. I mean, I know that sounds a bit sort of weak and watery compared with some of the drug treatments and the research going on, but there's nothing like, everyday enjoyment, but also keeping abreast of the resources that are out there and keeping up to date as best you can. And you may well be the person who actually educates your doctor. I mean, a lot of people think chronic fatigue syndrome is very common, and in some ways it is, but your doctor is looking at dozens and dozens, hundreds and hundreds of different illnesses. And this is just one small part of that whole scenario of illness. And you may well have to be educating your doctor. So you can actually get some very good resources online. And you may well find that your doctor becomes very, very interested as long as you approach it in a sensible way. I wrote that book probably 6, 7 years ago now, and find a lot of people enjoy reading it, but I don't want to be pushing it hard, but it's there if anyone wants to read it and get a hold of it. Charles Shepherd in Britain has also done some very good writing, and he is the medical advisor of the British ME Society. And he has produced a wonderful booklet which he sort of reproduces every 2 years, really, about the management of the illness. So it's right up to date, whereas mine's probably getting way out of date now. But it's quite good to have some sort of handbook that you can refer to, and also the booklet that Charles Shepherd produces, which is quite a chunky tome, can be sent out free to your doctor. So that's very worthwhile doing because your doctor, you don't want to be teaching your doctor how to do his or her job. But on the other hand, the doctor often doesn't know where to go to actually find some useful information. So you could ask the British ME Society to send that booklet to your doctor um, without trying to push it at your doctor and make he or she feel that you're really trying to do the medical education. But certainly it is worthwhile doing. Long COVID, well, let's say COVID, as we know, is a viral illness, um, a new virus that came into being a few years ago now. It's probably been around for a long time. And there will be a certain percentage of people who obviously get a very severe illness with it, others whose illness is very mild. And so you get that whole spectrum of illness. And there will be a percentage of people who do develop what we now call long COVID, which is the same as chronic fatigue syndrome, but it just drags on and on and on in the same way. And so the person may well have started out with what seemed like a flu-like illness, but they haven't got better. So I don't think long COVID is any different. It's just caused by a different virus, and every person with chronic fatigue syndrome could have one of many viruses. So long COVID isn't any different, but it is quite severe for some people. And of course, many people who end up with long COVID have always been very healthy people. Suddenly they find that if they push themselves hard, either with exercise or effort or work or study, they run out of steam very, very fast. And the mechanism is probably exactly the same as the mechanism we see in chronic fatigue syndrome, and we see all age groups. It's not something that's been talked about much in very young children yet because I don't think it's kind of, there hasn't been enough time to do all this research and assessment. But I think without doubt, the treatment plan and the diagnosis is going to be much the same. I think the one good thing that's probably come out of long COVID is that it has made much more recognition of chronic fatigue syndrome. So whereas before, chronic fatigue syndrome or ME was just talked about, oh yes, she's got this or I've got that. Now, because of long COVID, many, many people, and people like teachers and doctors and employers, are much, much more aware of the terminology long COVID. It's more meaningful, but it can be a very serious disease that goes on and on. But the treatment is going to be much the same. But I think the other good thing about long COVID, it's probably led to an absolute huge body of research, and this will help in the whole management and diagnosis of ME, chronic fatigue syndrome. Well, I think it doesn't, it's not that the infection isn't there. The infection is there probably for a lot of people, but most of the people we see with chronic fatigue syndrome, it's the aftermath of the infection. The infection has triggered abnormalities in the immune system, which are causing the symptoms. So persistent infection, it may not be the persistent acute infection that you started off with, like, say, flu or COVID or a cold or glandular fever, but it's the way the immune system has responded to that infection and not yet settled down. There is always the potential for that immune system to settle down, but the symptoms are due to the overactive, overbusy immune system rather than the actual initial infection. And the persistent infection doesn't show up in these blood tests because the infection itself is probably kind of dormant, but the effects on the bloodstream are not easily tested for. We can't easily show them at all. Those tests are just not out there, or if they are out there, they're very much in the area of research, or research that hasn't even been done yet. I think that's a very regular question that one gets asked, and it's not necessarily even just antibiotics. People will find other medication that seems to have helped them. And we have to say, maybe, if it was an antibiotic, they've just been lucky that they have had an infection that has responded to that particular antibiotic. That's not a common response, really. So that person may have just been lucky, or they may not have had the right diagnosis. They may have had some underlying infection which has been lurking for some time, and they just happen to be lucky that that antibiotic has worked for them. Or the antibiotic may not be working so much as an antibiotic. It may just be having a kind of livening effect in that person. There's so much we still just don't understand in medicine. I mean, we have moved on from the Dark Ages, but medicine is going on so rapidly that one can never quite keep up with the potential treatments. Well, I think fibromyalgia is not so much a disease itself, it's a symptom, really. Fibromyalgia used to be called muscular rheumatism or fibrositis. It's an inflammatory condition of the muscle, maybe due sometimes to injury or an underlying illness of some sort, but it's a symptom rather than a disease. And many, many people with chronic fatigue syndrome do suffer from fibromyalgia type symptoms. And when we talk fibromyalgia, for some people, it seems to be the principal diagnosis, may not be chronic fatigue syndrome at all. Or for some people, it's a symptom, a bit like a bad headache's a symptom. It occurs, and we don't know quite always the reason why. We might know the reason why, but we may not. So fibromyalgia is a bit of a difficult one. Sometimes it will come on after a bad injury, for example, and people are left with fibromyalgia following that or following some other disease. But it's really a set of symptoms rather than one specific entity. Well, I think there are a lot of theories about it, and there will be some people with fibromyalgia where they find a definite cause that's perhaps not even an ME cause at all, and they get treated. It can be a very difficult condition in that sometimes just no treatment seems to work at all, but it's principally a pain condition, and of course, ME is a pain condition, so there's a huge amount of overlap. But on the other hand, there are many, many causes of fibromyalgia which may be totally unrelated to ME. But I think the two overlap quite considerably, as do other illnesses too. I mean, there's one called Ehlers-Danlos syndrome, which very strongly overlaps with ME, but is not ME. So I think you get various different illnesses overlapping with each other. It's probably much the same as here. I think, the problem is that this is an illness that's very complicated. So many GPs haven't really ever been taught much about it. It's a sort of fairly specialized condition, and there are so many diseases that you learn about in medical school that you don't always pick up on all of them. I think many GPs now are becoming much more interested because of the long COVID thing, which has become more prominent. But I think part of the problem is there's very little medical education about this illness, as with many, many other illnesses. And doctors learn a lot about the conditions that they have patients with. So if your doctor happens to have three or four patients with ME, he or she may well become very interested in it and read up, and but there's a limit to the amount of time and the availability of things to read up, and that's why I think Dr. Shepherd's book from England is very, very useful for ME doctors or doctors getting interested in ME. But I think part of the problem is the doctor doesn't know very much about it and so has got to explore it. It's probably beginning to become much more explored because, again, of long COVID. So that long COVID has done us a service in some ways, if you could look on it that way. But at the end of the day, your doctor becomes interested in the illnesses that his or her patients have, and those illnesses may be many, many and varied. But I think often it's the patient who ends up educating the doctor about some conditions. So without being sort of pushy, it's quite good if you can take information, written information to your doctor, not huge quantities, but little pamphlets that happen to come your way, and you can say, well, do you think this is me, doctor? That kind of approach. So you're educating your doctor as much as your doctor is trying to treat you. It would be lovely to be able to say that treating the mitochondria was the key to recovery, and it might be. And I think this is the problem we have with many of the aspects of many diseases. Um, it certainly does involve the mitochondria. We know that for sure, but we don't know quite why or how. And I think you often find you'll get one or two researchers doing a big research study on something like that, and they may suddenly come up with a exciting answer. And I think all you can say is that follow the research as best you can. It's beyond me, much of it. It's terribly highly high-powered and scientific. But if you've got that sort of bent or someone who can help you interpret what's going on, it's always worthwhile reading up and learning as much as you can. And treating the mitochondria might be the key to recovery, but I don't think we're that far on yet. And unfortunately, people often hear of madcap cures, unfortunately, that someone's trying to promote some new medication or something, some way of dealing with it. And, the person may spend a lot of money trying out some new supplement or something like that. So I think you've got to be very, very careful and find out as much as you can about things like this and try and keep abreast of the research. Go to your support group, talk to your support group leader, maybe find speakers sometimes who can come and talk to you about some of these things. But I don't think we're that far on yet, really, with mitochondria. I think it's a very apt question, that one. We know for sure that any illness is aggravated by stress, and that's not to say the illness is caused by stress, but stress will always maintain ill health if it's not dealt with. So I think going back to that, I mentioned earlier on, having some form of learning some relaxation techniques or doing things about stress, finding out what the stress is and why and all the rest of it. Because stress definitely does, as it says in this question, aggravate cortisol levels, and cortisol is very highly tied in with stress. So everything you can do to moderate stress, which is one thing you can actually do for yourself, is going to be of some benefit. The benefit may only be tiny, but on the other hand, the benefit could be enormous. So dealing with stress, understanding stress, and it may be one way that you can help yourself somewhat, or you may need someone to help you. But I'm not saying stress causes the illness, but stress aggravates every illness, aggravates every aspect of our daily life. So the more we can do about that, and choosing a technique that will help us with that is not going to cure the condition, but it can be very worthwhile. Certainly, any viral illness can cause upsets in the heart rhythm, um, in the way you breathe, and many, many symptoms can be aggravated in that way. And I think, many people will find that if they recognize what's been causing some of the symptoms, and it may be just pushing the body too hard. So-called post-exertional malaise is one of the main symptoms of chronic fatigue syndrome. And people have often said to me, oh, malaise sounds a bit lazy, but it's actually one of the recognized symptoms of chronic fatigue syndrome. And it's nothing to do with laziness at all, because most people I see with chronic fatigue syndrome are anything but lazy. They're trying very, very hard to get themselves back on track again. So there's no doubt about it, this so-called PEM or post-exertional malaise is considered one of the core principal symptoms of the illness, and learning to moderate one's exercise and activity to fit within the boundaries of your ability and your energy will certainly be very worthwhile. It's not going to cure the illness, but it will help control some of the symptoms gradually. I have seen patients over the years who have recovered completely. They would generally be patients who have not had the illness for very long. Um, when I say very long, I mean not more than maybe 6 months or something like that. That is quite a long time, of course, but people who've had the illness for, let's say, 3 or 4 or 5 years, are probably less likely to recover than someone who's only had it for 6 months. So length of time certainly is an aggravating factor. Pushing the exercise is a very aggravating factor. But I've also seen many people who have seemingly recovered completely and never looked back. And I think partly that is because they've learned how to moderate their activity and exercise. And you find people who are constantly pushing the exercise hard will often be the ones who have a relapse or get worse. So I think, the person with chronic fatigue syndrome has got to learn to use their physical ability very cautiously and only build up very, very slowly, and be prepared to give in if they get a resurgence of symptoms. Well, I think, antibiotics can certainly get rid of a lot of your good bacteria in your gut as well as your bad bacteria. And sometimes the treatment for the bad bacteria is absolutely essential or could be life-threatening. So we have that sort of extremes, really. But certainly, if antibiotics are needed, then they may well be very important and the microbiome can recover. However, if the antibiotics are not needed and they're pushed too hard, that can cause a real ongoing imbalance, which may take a very long time to recover from. Well, I think I would be very cautious about that one because, I don't know enough about this person's background as to why they had the kidney removed, how healthy the other kidney is, and so on. So I think you need to be fairly cautious and discuss that with your GP, um, because we don't want to risk anything. And extra salt for most people is not going to be harmful unless they've got problems with their blood pressure. Certainly with kidney disease, there could be some risks. So not knowing enough about the person's problem, it would be important that they discuss it thoroughly with their doctor or kidney specialist. That treatment was used a very long time ago. When I first got into chronic fatigue syndrome, ME, there was a doctor using intravenous immunoglobulin in Australia that I knew very well. And it's used not regularly because in some countries it's very expensive and it's not also suitable for everybody, but it's certainly a treatment that does pop up from time to time, and you hear of a doctor somewhere using it. And for some patients, it can be successful, not curing their condition, but maybe giving them some level of improvement. One study, that the one that I heard about quite a lot, was in Australia with children with ME, and there was certainly some improvement, but it's never gone on to be looked on as one of the main important considerations for treatment. I don't think the treatment is necessarily that major. Well, the tilt table test is done reasonably often because so many people with chronic fatigue syndrome do have very low blood pressure, which is aggravated by standing up for any length of time. And this condition is known as POTS, or postural orthostatic tachycardia syndrome. And this is an abnormality of the cardiovascular system, which tends to be aggravated by ME, whereby if you're standing for any length of time, you begin to feel very faint. So a number of treatments have been tried, and particularly treatments that can raise the blood pressure a little bit. But the important thing for a person with this condition is that they actually get up very slowly and cautiously if they've been lying down for any length of time, and move from sitting to standing cautiously. And it's particularly noticeable in youngish people, children who are made to stand in line in the hot sunshine. They become very rapid heartbeat and often feel very faint and even do faint. Well, I don't think the actual shock causes the fibromyalgia. I mean, again, this is just a condition which can flare at times when you're very run down, and certainly that could be at a time of a shock. The actual cause of the fibromyalgia is often not actually known, but the person may well have it lurking in the background for years, tendency to aches and pains and things, and then suddenly something happens which throws their whole system out of kilter. And certainly a severe shock can cause all manner of sets of symptoms. Okay, well, it's certainly always important to get a good diagnosis, whatever's wrong with you, because you're not going to get the best possible understanding or treatment unless you get a proper diagnosis. And sometimes getting a proper diagnosis is very, very hard. I do know that. And mast cell activation is a different condition, really, but it's very related. It's got sort of common ground with ME, and it's a tendency to have quite violent allergy attacks, really. A great sort of tendency to react to things more so than the normal healthy person would. I think it's the IVIG is used from time to time. Doesn't work for everybody, and all part of the immune system management, and it needs to be managed very, very carefully. And it certainly isn't something that's on the regular radar main screen. And it is very expensive. But there will be some people who have said, yes, they have done very well on it. But again, it's like a lot of things. It may be partly because we don't understand enough about the underlying condition to necessarily recommend it, but it certainly has helped some people. Very, very worthwhile for many people. And that's because, not because we're saying that the condition is definitely a um, allergy condition. The antihistamines are used to treat allergies, of course, but because antihistamines can improve sleep enormously if you choose the ones that are sedating, and by improving sleep enormously, you often get a great deal of improvement in your CFSME. Overactive bladder can be due to all manner of symptoms, to all manner of underlying diseases, I would say. Not necessarily a disease. It may just be a really unfortunate bad habit, or it may be due to some sort of poor muscular control of the bladder. And I think for that set of symptoms, one would say you need to go and see someone who specializes in that area. Okay, well, I think some people have a born with a, slightly abnormal blood test, or it comes and goes over the years. I mean, we don't, not all exactly the same and entirely normal. Some people it's higher, some people it's lower. So it may just be a um, tendency that way. But of course, it may also be heralding some other illness. And certainly, it would probably need to be investigated from time to time to see if there are any changes. And over time, of course, new blood tests come to light, which may give an answer to why this particular blood condition is occurring in this person.